I presented again on the mechanism of resistance to CAR T cells, in particular focusing on lymphoma. And so we are very excited about the clinical results of CAR T cell in lymphoma. However, we need to recognize that the majority of patients actually do not respond or eventually relapse to CAR T cell therapy. And so we really need to understand what are the mechanisms of resistance in order to develop better products. And so what I was presenting earlier today in my presentation is that we have three main categories of relapse after CAR T cell therapy. One is related to the CAR T cell dysfunction, so the T cell can be exhausted to start with, can become exhausted over time or dysfunctional, and that can be a cause of relapse. The second one is the role of the tumor microenvironment and the host factors. There are a lot of immunosuppressive cells in the tumor microenvironment that might inhibit CAR T cell function. And the last one is about the tumor intrinsic mechanism. And that's where I really focus my presentation on two main stories. One is the antigen loss. So this is when the lymphoma cell lose expression of CD19. And in our cohort of patients, we saw that in about 30 to 40% of patients by doing immunohistochemistry at relapse. And I went on discussing potential strategies to overcome antigen escape. And I described targeting CD79 as a new target in combination with CD19, and we did some preclinical work on that. And then I moved to the apoptosis. So another intrinsic mechanism, tumor intrinsic mechanism, is the fact that the tumor cells can be resistant to apoptosis and thereby not being killed by the CAR T cells. And so in that regard, we studied BCL2. BCL2 is an important target because it's the target of venetoclax, which is an FDA-approved inhibitor of BCL2. And we showed that you can combine BCL2 inhibitor with CAR T cell in vitro, but if you do in vivo, you will see that the combination is toxic to the CAR T cell. And so we developed a strategy to make the CAR T cell resistant to venetoclax so that now you can combine them efficiently with venetoclax. And so this was basically the summary of the challenges and what I presented during my talk.